Welcome everyone to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. We're recording this podcast on November the 9th, 2020. Thanks for joining us today. The U.S. set the wrong kind of records last week with exponential growth in coronavirus cases, 100,000 in one day. This incredible surge in infections is leading to increased hospitalizations and putting strains on the healthcare system. Here to discuss this with us today and to give us our weekly COVID-19 updates is Dr. Greg Poland, virologist, vaccine expert, and infectious disease physician from the Mayo Clinic. Hi, Greg. Thanks for being here.
You bet. You're exactly right, talking about these records. I mean, we are now over 10 million cases with, almost 245,000 deaths. That's one out of every 1,400 Americans. Europe has surged. They're over 10 million cases with slightly more deaths. So this is not only a national problem, but a transnational problem that needs national and transnational policies around this.
We've talked a little bit about current COVID numbers, and there's also been some news in the world of vaccines. Pfizer announced today 90% efficacy for their vaccine. What's the latest on vaccine development? What does this mean, and where do we go from here?
What they're reporting is the very first earliest sliver of their study goals, which was what is the efficacy 7 days after the second dose. They're reporting by press release, we don't have any peer-reviewed data yet, they're reporting greater than 90% efficacy. So we really need the details on that. But there's much more to come. Nobody cares, if you will, about a vaccine that protects you for 7 days. They're going to want to, and they do have planned. What does it look like at 14 days, 1 month, 6 months, 12 months, and 24 months? Those will be the important and compelling data because it will tell us something about durability of that protection. The other issue is safety, which we've talked about. We only have a modicum of early safety results, so we're going to want to see those as time goes on. And then a point that I don't think any other scientist, frankly, has thought of beside myself, and that is these are efficacy studies being carried out in a world that, for the most part, is masking and distancing, begging the question of what is the efficacy of this vaccine with masks off, without distancing. I think that's going to be very important. Remember, too, that this is a vaccine requires 2 doses IM, fairly reactogenic, 21 days apart, and requires an ultra cold chain, -80 centigrade. So, that's going to be logistically difficult in the US, probably a non-starter outside of the West.
Greg, when will we have answers to some of those questions like, is it really going to work? And will it work in real world conditions?
The other thing to sort of think about here is that this is efficacy against mild symptomatic disease. We don't know anything about severe disease, death, transmission, asymptomatic disease, efficacy in children, pregnant women, highly immunocompromised people, the oldest of the old, specific subgroups. For example, the Native American population has been very hard hit. I don't have the data yet, but my guess is that they don't have a large number of Native Americans enrolled into the trial. They do talk about fairly impressive diversity of 30 to 40%, so that will be important. We won't really know what happens until time goes on with these 44,000 that have been enrolled, or until an EUA or expanded access mechanism gets used and hundreds of thousands and millions get the vaccine and are followed. What would it mean, for example, I don't know this, but let's just do the mind experiment. What would it mean to have a vaccine that protects you for 3 months or 6 months against mild disease, but not severe disease? And a requirement at 6 months or 12 months or 24 months to have a booster dose of the vaccine. Those are all things left to figure out about this very curious virus.
Obviously, we have a significant problem in the United States with this. And I'm wondering, does this require a national approach or strategy? And what do you see as our path forward and the likely steps that President-elect Biden will take with his task force?
We are now exponential in the number of cases. Exponentiality cannot be controlled absent one of three things. Either the virus changes in some way so that it's less transmissible, we lock down the nation, as Europe and other countries are now recognizing they have to do, or we enforce the way some states, Utah, for example, announced mandatory masking in an attempt to control this. Otherwise, the system will be overwhelmed, and many more people than we ever want to think about are going to get seriously ill and or die as a consequence. This is a national problem that requires a cohesive national policy around it. It is also transnational, and we need coherent transnational policies. The most immediate thing we can do is what the science shows us: distancing, closing down environments where high rates of transmission occur, wearing a proper mask properly, and probably restricting travel and other activities that we know lead to issues, such as what we're seeing with variant viruses showing up in Europe. And then, of course, the last thing would be when and if we have a highly efficacious, safe vaccine that the majority of the population, actually a super majority of the population, would be willing to take in order to control this.
One of the things that I was thinking of, Greg, that has seemed different from, I think, even city to city in some cases, and certainly state to state, are mandated masking policies.
Yeah.
I believe some states still don't have mandated masking policies in public buildings. Some states are leaving it to local jurisdictions. What do you think about that?
This is an absolute tragedy. This is not about politics. This is not about religious ideologies. This is about science. A mask is a simple thing to wear and a simple thing to ask of people. In my opinion, we need a mandatory masking, enforceable, the way it is, for example, in the UK. A great policy that was released just recently is the state of Utah, which had no policy in effect. And they have recognized what is and what will be happening to them. And they put into place a variety of well thought out measures. And we need to do that. Every state, every locale, as I say, otherwise people are going to get hurt. And, you know, Helena, because of your work as an anesthesiologist, you certainly have seen this. When you get into mass casualty type situations where the system is overwhelmed, mortality goes up, even with the same team, same equipment, same therapeutics, because you can't give state-of-the-art care to 10,000 people at once in a medical center. You can only do what you have personnel and beds available for. And much of this can be prevented by masking. It reduces the chance that you would get infected by over 70-fold. I mean, if that were a medication, we'd be celebrating the efficacy of this. So we really do need a policy like that. We are now past contact tracing. There's too many cases, too dispersed throughout the entire nation. We need to take action. We need to take action now in order to protect lives.
Sobering reminder to wear our masks, social distance, and clean our hands.
Yeah, and you know, the other thing we've talked about, and it's hard for me, is a certain kind of what's been called COVID fatigue. And I'm very, very concerned that is going to be a major issue that will take us to the absolute unimaginable heights of this as we have kids returning from school, as we have Thanksgiving and Christmas holidays, and people are tired of COVID. So the sooner we get this thing dampened down and in check, the better.
Another thing that I've been reading about in the news, Greg, and I think you might have touched on it just a little bit earlier, is about mutations of the COVID-19, the coronavirus.
Yeah.
And one rather intriguing article that caught my attention was a story out of Denmark that some of the mink were being infected with COVID and were dying. And I'm wondering, is that because of mutation? What should we expect? And should we expect to see more of that in animals?
Yeah, again, a very good question. There's some very large studies looking at a variety of different animal species to understand what species can indeed get infected and transmit it. Turns out that mink, at least mink in the kind of conditions where they're crowded in, unfortunately, is an animal species that is easy to get infected and transmit it mink to mink, and this is the important part, mink to human. So what we're seeing, not unexpected at all with RNA viruses, is that mutations and genetic recombination occurs. This is not good. This is not good news for the field of controlling coronavirus, because all that needs to happen is key mutations, which would either make it more transmissible, more severe, or escape our current therapies or vaccines. I wrote about this and published about this 4 or 5 months ago, concerned that this very thing could happen. So we're going to need to keep our eyes closely on this. It raises this issue about transnational policies. You know, when you look at Spain, France, Ireland, Switzerland, Latvia, a number of those countries, not only are cases surging, but they are surging with 2 new variant viruses. No indication right now that it causes any difference in the immune response or in the likelihood that a vaccine would protect, but we don't know that yet. And all that needs to happen is multiple mutations in the wrong spot. And one of these mutations is right next to the receptor binding domain. In fact, it seems to increase the receptor binding affinity with the ACE2 receptor many-fold. And if that's true, if that bears out, that is not good news. So we really need a policy that not only controls the pandemic in humans, but also remembering this is a zoonosis and it travels animal to human and human to animal. Now, I don't want our listeners to be alarmed. This does not appear to be the case in domestic animals like cats or dogs, but in outbred animal species that are being grown and are close together, like mink farming, unfortunately in Denmark.
You and I have talked before about how amazing it is, how much we have learned about this coronavirus just in this brief period of time since about January of this year, yeah. But how much more there is to learn because things keep changing and we keep finding out new information.
Yeah, and I think, you and I are aware of this as scientists and physicians, but we're always thinking about what is it we don't know that we don't know? What is it that's going to surprise us as time goes on and we learn more? And we don't want to be arrogant as physicians or scientists. We want to have an open mind. We want to be appropriately skeptical of assays, of treatments, of vaccines, and see peer-reviewed data in order to understand these issues. That is the hallmark of good scientific method.
Well, Greg, do you have any last words of wisdom for us before we go today?
I never want to miss the opportunity to say, get your flu vaccine. If you are eligible for it, get your pneumococcal vaccine, wear your mask, clean your hands, and keep your distance. It's hands, face, and space. It's that easy.
Hands, face, and space.
Yeah.
I can remember that. It's great. Thanks for being here, Greg.
My pleasure. Think positive, but test negative.
I love that one. We need bumper stickers.
Yeah.
Our thanks to Mayo Clinic, infectious disease expert, virologist, and vaccine expert, Dr. Greg Poland, for being with us again today to give us COVID-19 updates.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well.